Hello and welcome to Let's Talk, a series of podcasts brought to you, as always, by Hazel and Betty Ford. And as always, I'm your host, William C. Moyers. We're glad you're with us today. And today I'm excited to share the studio with my colleague, my friend, my fellow traveler, Robert Poznanovich, to talk about workplace wellness and the impact that the use of substances and mental health issues has on employees, on management, the human resources of a company, and on a company's bottom line. Bob's the Vice President of Business Development for Hazel and Betty Ford. He joined the organization way back in 1997. But once upon a time, he was known as Chicago Bob. Welcome, Bob. How in the world did you get the moniker Chicago Bob?
So it's going to be 27 years ago Monday that I went to Hazelden to start my recovery journey. And I walked into my unit and they said, "Hey, what's your name?" And I said, "Bob." And the peers said, "Oh, great, there's 7 Bobs here, so you're going to become Chicago Bob." And it's a moniker that's stuck ever since. So.
Well, we're glad it stuck. We're glad that you have walked that walk a day at a time. And what a difference you've made in our organization and with our mission. Now, the Vice President of Business Development, what does that mean exactly?
Well, I have the privilege of representing our promise of recovery to those communities in the business world that either pay for treatment, refer to treatment, influence treatment, and could drive cultural changes within their organizations to make recovery more available to more people.
And one of your big emphasis, one of your key messages is all about workplace wellness. What does that mean?
Yeah. So I think if you look at the role that workplaces play in overall health, workplaces could change culture and can change behavior. Think about years ago, smoking, for example. It was a desk accessory when you started an employer and they give you your phone, your pen, and you get an ashtray. You think about today that not only do that you can't smoke on campus, you can't sometimes smoke a mile away from campus, and there's employers like some health systems that won't even let you work there if you smoke. So we make big cultural changes. And I think substance abuse, if you look at the math and the numbers of the number of people that are impacted by this, directly because of their own uses or indirectly because of their usage in their family or in the workplace, is a huge number, but it's been really underserved in the workplace as far as being addressed. So I think there's a big opportunity to change behaviors to help people get help. And a lot of that can happen at the workplace, like they've done other well-being strategies, wellness on physical health and mental health.
Yeah, and mental health is an equal issue in terms of what you're trying to do around substance use issues, right?
I think we're trying to raise the visibility that all behavioral health is an area that needs to be addressed. And if you think about where we're at right now in the world, we have probably the biggest psychological crisis that we've had ever in this country. If you look at the data behind COVID, there is 50% of the people are struggling in ways that they haven't struggled before. They talk about 30% of the workers now who are working at home have drank during work. Now, it doesn't mean they're alcoholic, but they changed their drinking behaviors. And if you think about it, it really is starting to develop as an actuarial time bomb. That says if I have all of these people who are struggling from a mental health perspective, that maybe some of the normal control mechanisms that existed by going to work every day and being around peers and having that 9 to 5 kind of structure where I would drink when I got home, when all those built-in control mechanisms are gone and I'm at home all the time by myself, that usage is increasing at very significant numbers. That implies that there's a lot of employees who are getting sicker. So we've got people who are struggling with mental health, and we've got people who are struggling with substance abuse at higher numbers. And the question is what do you do about it in a preventive, early intervention, harm reduction environment in the workplace so that you don't end up with the consequences of the cost moving forward? So I think there's a lot of organizations are looking at how do they increase the benefits to employees for mental health. But I think it's really important that they don't just stop for mental health. They've got to look at the inclusion of substance abuse as they're building their new well-being strategies, because if they don't have substance abuse in that strategy, they're going to miss a big opportunity to serve their populations better.
And the well-being strategy in the workplace is making sure that the benefits, the insurance that covers the employed person and the employed person's family includes addiction and mental health services, yes?
Right. So it's coverage for sure, to make sure that they have the right types of coverage and at the right programs to support really good outcomes. It's also about access. So as we're building strategies that says, convenience and access, how do I get my employees the opportunity to say, I'm okay not being okay.
Huh.
And is there those pathways that allow them to anonymously, without fear of retribution, be able to reach out for help?
Yes.
So I think what you're seeing is organizations that are starting to create new pathways. Either they're partnering with new companies who are starting out in the digital and virtual world, or they're partnering with existing companies who are creating new pathways for employees to say, here's easier ways to gain help, to maybe access content, to access virtual services, to start to get engaged in help. So it's coverage and it's convenience of access that makes it easier for people to get it. I think what they still have to address, and one of the big hopes that I have is that we use this opportunity to address stigma.
Okay.
I think that mental health is becoming less stigmatized, but it still is an issue. And substance abuse is still a huge stigma issue. All the data says that most employees are so afraid of retribution in the workplace that they won't even ask what their benefits are, let alone ask for help. Yeah. So you talk about you got to get the right benefits, but we also got to get the environment created where it's okay to ask for help too.
Yes.
And I think that is the opportunity that we're trying to advocate with organizations now. It makes sense from a lot of perspectives. Employee retention, hiring today is important. Healthy workplaces are important. Managing risk associated with accidents and violence and harassment are all issues that we have to face every day. And of course, the growing cost of healthcare. Mm-hmm. And I think a lot of organizations haven't looked at the correspondence between behavioral health and substance abuse and violence, accidents, and healthcare costs. We know that somebody with a substance abuse is 5 to 10 times more expensive than somebody who's not. Mm-hmm. So I think it makes sense. And you used the line in your opening about how it affects the bottom line. I think the other real benefit of this is it clearly will impact the organization's bottom line, but it will help save lives too, which is the ultimate bottom line.
Yes. So Bob, talking about stigma, there is a perception out there that people who are addicted to alcohol or other drugs, or people who are struggling with mental illness, are either unemployed or unemployable, but that's not true.
No, in fact, when I ask people often when I give some presentations to think about the image that I have when we talk about somebody who's addicted to drugs or alcohol, and most people will say they thought it was the person under the bridge. Statistically speaking, it's less likely it's that person than it is the person sitting next to them. 70 to 80% of the people who have a substance abuse problem are working full or part-time, which means that school bus driver who we trust our kids with every day, on blind faith, yes. Is that one of the people who are struggling, right? Yes. So, it happens or your doctor, or your pilots, or the person in charge of, corporate quality control, right? Or operating heavy equipments. I mean, nobody's really immune to this. There's no company that has the magic, as I say, water cooler that allows them to recruit, just the right people, so they don't have substance abuse problems. It affects, 1 out of every 8 of us.
So then where does workplace well-being start? Does it start with the union? Does it start with the HR director? Does it start with the CFO, the COO, or the CEO?
I think it starts everywhere. To look at that, how do we take that step to change the culture, to say that, again, getting back to it's okay not to be okay, to be proactive in helping our employees and their dependents, which is another big component of well-being, get help. So I think it's that cultural shift that says it's okay for us to say we have this problem. Mm-hmm. I've been chasing this for 20 years.
Yes.
We started this campaign many, many years ago.
Making recovery America's business, we call it.
What was that? What year?
2005.
So it's
20 years ago, practically.
We were well ahead of our times, but
yeah.
People didn't want. When I work with organizations, for example, I worked with a manufacturer, a drug manufacturer, who said, we have a problem with some of our employees that use drugs, but we don't want anybody to know about it because we make drugs, we don't take drugs. And I laughed. I said, well, why am I here? So clearly you do, but it's a PR issue. So I think we have to get past that we have substance abuse in our workplace, because it's common nature. It's everywhere. If you do the math, if every 1 out of every 8 of us has a problem, and you think about the size of a family, it's like 1 of every 3 of us has got something going on somewhere.
Yes.
Either ourselves, at the workplace, or in our home. So,
yes.
Not to address it is a big miss. So I think it's that saying we're okay from a risk perspective to say that we're going to provide resources. We're going to address this issue. We're going to make it, the cultural change that makes it okay for people to come out and ask for help. We're going to create pathways that makes it easier for people to address this. And then when they get back to work, which is the other cultural change that they could make, it's to accept them.
Yes.
It's to create, and I know there's organizations out there who've made big steps, that they're funding initiatives or affiliation groups within the employer group, so they're making it okay for people who are in recovery, however they got into recovery, to get together on company time or using company resources and communities and virtual services to be able to peer support each other, and to address not only recovery issues, but recovery in the workplace issues, and to make it more normal. Yes. Now, they've done this for other diseases, right? I mean, they've done this for, there's programs when people leave for pregnancy to have time off and return slowly and in partner with other, for example, young mothers, mothers who've had young children. But when you think about the number of people that are impacted by mental health and substance abuse, like, why not there too?
Right.
So I think we've got the models. We just need the courage to say, let's extend it to substance. I think we have to overthink it.
Yes.
We've put a lot of strategies in place for the workplace to address illnesses that are really expensive. We've built centers of excellence programs to make sure people get to the best place to provide a heart transplant. So we know how to do that. We know how to pick really good providers that provide good outcomes. We know how to address diseases that are costly and deadly. We just have to implement those same strategies with substance abuse. Make sure you got good coverage, that you've got good facilities that provide good outcomes, that you've got good return to work strategies to support these employees. I think it's just about courage. It's the courage to change that we talk about for the alcoholic and the addict. Yes. It's also the same for the organization, the courage to change.
And one of the big changes, since you and I had launched that initiative, Making Recovery America's Business, is what happened back in 2008 when Congress passed and President Bush signed into law parity legislation that really helped to level the playing field in terms of employees being able to access addiction treatment or mental illness treatment through their insurance. Talk more about that.
Yeah. So parity did some really great things, and I know you worked hard to accomplish that and help the country get there. The good side is it made care much more available to more people. It also opened the door for some of the people who knew how to profit from the availability of many more patients in the market. And some of these providers that were for-profit, chased the revenue, created programs that sometimes were unethical, even many who've been illegal. And they've employed some patient recruiting strategies that are really bad for the patient, bad for their experience, and bad for their outcomes. There's been many of those have flocked to warm climate markets like California, Arizona, and Florida, particularly Florida, who's had a disdain for some of the regulations around this. And now there's crackdowns. I think almost every day you'll read about somebody or some group of people being arrested for abusing insurance laws, patient safety, patient brokering, or in cahoots with drug testing companies or whoever, paying people to relapse, paying people to recruit other people who are struggling. So I think what's happened, and this is one of the things that's gotten the employers that I'm working with attention, is the impact on the individual who gets help and the cost. Those organizations are typically much more expensive. They don't tell the whole story. They often leave the patient without a lot of care and support. And they return to the workplace sometimes even sicker than they were, and they pay thousands and thousands and thousands of dollars out of network benefit costs. So that's raised the awareness of employers to help them navigate what is legitimate care. So how do we get their employees to the right level of care at the right time for the right cost value outcome ratio, so that they could get in recovery at higher rates without having the trauma of having to deal with bad providers.
We've got about 2 minutes left, Bob, and I know that people who watch this Let's Talk podcast, some of them will be employees, some will be employers. What is your closing message to employees who are struggling with a substance use or a mental health issue?
With employees?
Yes.
That nothing could ever be gained in waiting. Oh. That if you woke up and today is the day that you're struggling, that make it today is the day that you make that first phone call. I know your story, I know my story. If we would have got the treatment earlier, it would have been a lot easier, and a lot less expensive, and not as traumatic on us and our family. So there's nothing, I think there's some myths around addiction that you can't help an alcoholic and addict until they hit bottom.
Right.
There's a lot, most things we know about addiction is wrong. And I think waiting and hitting bottom is one of those. So don't wait to get bottom. If you think today's the day, today's probably the day.
Well, I've always said the only bottom with this illness is death, and anything short of that is a way out. Before we go, though, so that's the message to employees. Don't wait. Ask for help. What's the message you want to leave employers with?
Yeah, I think the same message. There's nothing to be gained in waiting. That the problem exists. This has been a problem that's existed for a long time. But now there's enough momentum behind the problem because of opiates and people dying in offices from overdoses on floors. That now is the time to take action. It's a little bit of a culture shift. It's a little bit of a PR, conversation. But the benefits to the workplace, to the safety, to the costs, to the ability to save lives and change behavior, is bigger than the risk of not doing it.
And insurance, in most instances, covers addiction.
Yeah.
And mental illness.
Yeah, most of their plans are already covered. They just need to make employees feel that it's okay
Yes.
to get help earlier and to help them recover when they do get help, no matter how they find what help is.
Bob Poznanovich, thank you for taking the time to be with us today, for turning your own personal passion and your expertise into your role today at Hazel and Betty Ford of not just strengthening our mission, but reaching out and connecting to the community and indeed making recovery America's business. Thanks a lot for being with us, Bob.
Thank you, too.
And thank you all for joining us today. We hope that you will tune in for another edition of Let's Talk, our podcast series that comes to you from Hazel and Betty Ford. And remember, if you have a question or a comment, a criticism, my email address is wmoyers@hazelandbettyford.org, wmoyers@hazelandbettyford.org. Send me an email. I'd love to hear from you. And remember, it's never too early to ask for help. So if you're struggling, you have an employee who's struggling, a family member, ask for help. Thanks for tuning in to Let's Talk. We'll see you again.